Good morning, everybody, and welcome to the 12th Annual Southwest Camel Conference. We're doing things a little differently this year, going virtual with Zoom, and we welcome all of our participants, attendees, presenters. We have a dynamic program today with presenters from across the world, across multiple time zones. I expect that folks will be coming and going across our 3 sessions. We do have a special greeting that I'd like to share with you from one of our annual participants, trainer Coralie Lemur from France. And without further ado, here is her message and a greeting to everybody.
Hi, I am Coralie. I'm French. Farm. She had a baby 3 years ago and she should be pregnant for 10 years. So I own a little camel breeding farm since 10 years. And I also give camel ride, anything like birthday party, also wedding, and everything which is possible with camel. I try to do it. What I really like is to train camels. I like to work with them in liberty and be soft as possible when I'm training them. So this year I could not make it to the USA due to the virus, but let's see next time. And it was always a pleasure to come, and I hope so to be able to come again another time. Bye.
Thank you so much, Coralie. As Coralie mentioned there, we're having to make some adjustments this year for COVID-19, and I will request everyone's patience this morning. As a camel trek guide and camel trainer, computers and technology are a bit challenging, so again, I ask everyone's patience as we go through our schedule this morning, and hopefully we're able to see and hear everybody. We do have one programming change for this afternoon's session. We had Ivan French of the U.S. state of Oklahoma scheduled to present on camel fiber, but an early winter storm has taken out the power around the Oklahoma City area, and Ivan is not able to power up his mill and share with us what he does with camel fiber. So just understand that in session 2 today, the second presenter will be Samantha Arevalo. Samantha has graciously stepped in at the last moment and will be taking Ivan's place, and she'll be talking about camels in therapeutic settings. So we appreciate her ability to do that quickly. Now, without further ado, we'll get this first session started, and we're going to go to the Emirate of Al Ain, and we are going to introduce Dr. Abdul Raziq Kakar. He is originally from Pakistan, and he is going to share with us this morning what he does in camel dairying. So, Uncle Raziq, I'll ask that you unmute yourself, please, if you can. Very good. Thank you.
I did. Hello, everybody. Good evening from Al Ain, from beautiful Al Ain, the oasis, the beautiful place, the desert, the camels. We have everything here. So I hope you can hear me properly through mask, which is unusual for me. So I am here with my best camel friends. She will demonstrate you. She will tell you how to find a very good camel for milk, and how to milk the camel, and how to behave with the camel, how to approach the camel. So here I am, my colleague, he will fix camera on me, and now I will start my talk. So you can. Okay, देख रहे हैं आप? Okay, can you hear me? You hear me?
Yes, sir. Beautifully. Thank you.
Yeah. So here we are with one of the best dairy camel. She is the best dairy camel. So I really do not feel good with this thing. So this is dairy camel, and this she is from Majahim breed, one of the heaviest and the most milk camel in the world. One of. So she is almost 10 years old. She has calved 3 times, and she is well developed. Her body is well developed. So we can see when we look for a dairy camel, first we see the age of the camel. If you buy it from the market for milk, you must buy the camel which is not old. You need the camel which is less than 6 years. So then with the passage of time, she will increase the milk. That is number 1. Number 2, the camel must be very healthy. If my cameraman can show you, it must have very good drum of the ribs. You can see she is a bit meaty, beefy. So here you should see the ribs, the rib cage. You can see from this side, the rib cage is, she has very good rib cage. You can see, and she has very wide chest here, from here. So she has wide chest, and good barrel of the rib. It will provide opportunity to have very good breathing system. So the body needs oxygen, not only water, not only feed, it also needs oxygen. So also, please come. You can see the belly. The belly is very important. The extended, the large belly means it can accommodate much fiber. So the fiber, it provide opportunity for the microorganism. You know, the camel does not take the food directly. It is eaten by the microorganism, and the camel system, the gut system, it absorbs the microorganism and fulfill their feed requirement. Again, if you the body must be very proper body, and you can see she has very proper body. Yani the head, very clear cut head, very appropriate neck. The height, you can see the height, and a good hump, which tell the health, the body condition score of the camel. So this is like the score 5 for camel. I give 7 scores. This is score 5. So here you can see from the heart, okay, you can see we call this milk line. Zigzag, I have seen, and it is our experience, we have not yet released the data. The zigzag, this milk line, it is like one of the indication, one of the phenotypic trait for good milk. And here you can see this udder, it has like protruded and like very good udder. You can see when there is no milk, it is very like sponge, and it has like good depth. It starts from here, and she has very good teeth, I will tell you. And you can see the skin. You can see the skin. The skin is very healthy, the thin skin. You can see, it means she is good milk camel. The strong in the thick skin mean she is not good in milk. So she is good in milk, and you can see the veins, the arteries, the pipelines of blood, they are very prominent. You can see here, everything is very clear. So that is other thing. And also, I told you we see the age, and the second thing, the most important thing is the behavior. When the camel has good behavior, it is friendly, it will never get mastitis, because the angry camel, the complicated camels, they get mastitis. Number 3 is, we here, our criteria is we choose the camel which at least produce 10 liter per day, 10 liter milk, at least 10 liter per day. And also the camel must be fashush. I will show what meant by fashush. Fashush means easy milker. In Arabic, it is called fashush. In machine milking, we call it the short AMT, actual milking time. So when the milking time is less, it means she is good camel. So she will not get. So here I will show you. Now her cup is away. So we will just do like this. You can see the milk will come. You just rub here, and the top of the tip of the teeth. You can see. The milk will come. Slowly the milk will come. You can see also the teeth, the camel teeth, they have two orifices. I will show you. You can see two line of milk is coming. ये दो धारे दिखाना. ये दिखाना. It means there are two orifices, two holes in one teeth. You see, she is very easy milker. अभी दूर से मुझे भी साफ कर. She is friendly milking camel. You see, when she is happy, her teeth are okay. She is fashush, easy milker. It means she will not get any mastitis, any problem. This camel now, she has no more milk because she has reached up to 1 year. So these are the last days of her milk. So she will get pregnant this season, inshallah. You can see. Oh. Hello. Hello.
Good morning.
Good. Are you with me? You see me? Hello. Hello, sir.
Yes, sir. We can hear you.
Hello. You can hear.
Yes, sir.
So you can see the body and also the length of the camel. So the lengthy camel mean good camel, the good camel, the healthy camel, the appropriate camel. She has almost 600 kilo weight. So fashush, I told you, easy milking, and she has very good body condition score up to 5. We call it 5, and well-formed body. Like I told you, it must be very appropriate body. Like you see, the shoulder is little bit higher than this area, the tail area, the base of the tail. You can see, and this bulgy hump, you can see it is like this. Okay, and the very clear-cut skin, I told you. The veins you can see, and also spacey belly, the very clear neck, thorax drum, and also thriftiness. Some camel, they eat very well, like she is very good eater. So it means when she will eat good food, she will be thrifty, she will produce, she will fulfill the nutrient requirements for the milk. And also she must have very clean eyes. You can see the eyes. She has very clear eyes, pearls-like eyes, and also not only one-time demonstration, yani one-time selection. The camel must produce up to 2,500 liters per lactation, and she should produce milk for 10 months. If she is producing for 2-3 months, even if she is producing 15 liter, it has no value because we need the milk all round the year. And she must produce at least 10 months in one lactation, 300 days. And the other thing is the average lactation per day yield must be 8 liter, not less than 8 liter for our system. If it will be less than 8 liter, it means she will not give good return in kind of money. Also, so it means yani the lactation yield must not be less than 2,500 per year or in 300 days. Okay. Also, the other thing is this camel is almost 600 kilogram live body weight. So how much feed she need? She need at least 12 kg alfalfa, dry hay, alfalfa, most preferably alfalfa. And then we provide 7 kilo of TMR, total mixed ration. So then her requirement of 90 megajoule of energy and 200 gram of protein will be fulfilled. And she needs almost 150 gram of, 40 gram of calcium she needs daily, 40 gram of calcium. So this is like, I mean, the main things, the main parts. So if you have any question, you please let me know.
Dr. Raziq, I do have a question and an observation. You had mentioned the body scoring of this camel and in particular this breed, the Mujahim. The shoulder area must be a little higher than the hip area. Is this something that is specific to that breed of camel, or is it something that you would like to see in any dairy camel of any breed?
Thank you. Some points, some dairy points, some characteristics are not mandatory. So this is like the frame of the camel. It is not specific to some breed. The frame of the body must be like this. You can see, if I can show you from there, you see. If the camel is like crooked, decline or bowed to headwards, I mean, like, it means it is not good body. It is not good body structure. So the poor frame of the body means the poor camel. Even any animal, but this is not for specific for Mujahim. For any camel, she must have very good and very clear-cut frame of the body. So this frame is like slightly higher the shoulder area than the back side, and you can see the hump. There must be a beautiful hump. The hump which is to one side or other side, are very small or very heavy. It means she has some problem. If she is not producing good milk, she will have very heavy hump. It means she has very big hump. Big hump means she cannot convert nutrients properly into milk. Okay. Poor hump means she cannot keep the energy threshold with the milk yield. She is like consuming more energy and she has little energy to eat. It is either food problem or she has, some problem. But usually these things come with when the poor energy is provided in the milk. Otherwise, the camel, you can see, if I can show you, now you see. This is like very clear-cut body of the, you can see it, she must have like, it does not mean that we have one camel like this. I mean, the top thing is the mood of the camel, the behavior of the camel. When the camel has not good behavior, then what will be the problem? She will be angry milker. Angry milker mean there will be mastitis. There will be other issue. And the milk quality will not be good.
Fantastic. Hey, Dr. Raziq, it looks like Laura here in the U.S. state of Virginia, I believe, has a question for you. Laura, I am turning over to you. I believe you can ask your question.
Welcome. Hello.
Laura, you'll forgive me, but I don't believe we're able to hear you. We've got you unmuted, but we're not hearing you. Yeah, sorry, Laura, we're not able to hear you. Maybe you could enter your question into the chat box and we could pass it on to Dr. Raziq that way. Dr. Raziq will need you to unmute your mic. We can't hear you, sir.
Yeah. Mute and okay. So you see, these are other camels. They are lucky camel. They have fresh. You can see the milk vein, the milk line. It is like big pipe of blood. Oh, when they drink water, then they shake their head. They are friendly. The friendly camel are the best camel. If they are not friendly, they are not camels. They are something else. You can see, very friendly, very friendly.
Dr. Raziq, can you hear me, sir?
Yes.
Laura here in America has asked how many times a day are you milking the camel? Does the calf still nurse? And were you able to get the camel to let down the milk without the calf this morning, this afternoon, your time, for our demonstration?
Yes. Yeah. You know, we milk the camel 3 times. When they are in the first 5-6 months, we milk them for 3 times per day. Okay. The calf, they need calf. Like if you see the other side are camel, this side we have calf. So they meet their calves each 3 times, and the calves stay with them. But while milking, in the milking parlor, the calves are not standing with them. So they are used to. We train them to be milk in the parlor. So when they are milk in the parlor, they are trained. When they hear the voice of the milking machine and the environment, they enter. The milk let down is no problem. So then when they return, they come to their calves, and the calves stay with them for half hour or 1 hour like this. So the milk let down in camel, it is not like there is one common concept that the camel will not milk in the absence of calf. It is not totally true. It is good to keep calf with them, but it is not mandatory to keep calf in all circumstances. Otherwise, she will not milk. No, she will milk. I showed you with the just rubbing of the hand and with the tip of the teeth. So she will come to let down.
Thank you so much, sir. What a beautiful, beautiful camel. Clearly her milk vein tells us everything we need to know about her production abilities. It is clear
Also,
that she is taken care of.
One thing I just want to show you, when the camel get obese, they have more weight, then we keep them in the system, this walker, to lose some weight.
Wonderful, sir. Wonderful, sir.
You can see. Maybe you have other things. I just want to quickly show you, just because these things are very new. About the cows, many people know. About the camels, very few people know. You can see this bull is like, we want to train them, we want to make him. This is Majahim bull. This walker, you can see. This is our team. You know, they have camel on their chest. Hello, Yasser. Thank you. These people are from the same area where Gahlot is, Dr. Gahlot is. Hello, Dr. Gahlot. So please, if you have any question, this camel is from Pakistan. Bull. Barela bull. So if you have any question, you are welcome. Otherwise, you please proceed your process.
Very well, Dr. Raziq. Thank you so much for your time. I know that everybody viewing and tuning in this morning from across the world appreciates not only your demonstration, but your evident and very obvious love for the camel and all of your efforts to promote the camel in every way possible. Dr. Raziq, thank you so much for your time.
You are welcome. I am here since morning from 8 a.m. up to here. I did not eat lunch, anything. I was here just to tell you everything. I am very happy.
You have camel milk. You need nothing more, my friend.
Yeah, I took 2 glasses of camel milk. I do not need anything. Yes.
Fantastic. Yeah. Thank you so much, sir. We appreciate your time. Give our best to everyone on your team, and thanks to your cameraman as well for doing such a fine job.
Thank you very much.
All right, folks, without further ado, we will move on with the program. Our next presenter is Dr. Tite Gahlot. He is from India, the country of India. He is in the city of Bikaner. Dr. Gahlot, I will ask that you unmute your microphone, please, and that we can do a quick microphone check to make sure that we can hear you. Are you there, Dr. Gahlot?
Yeah.
Oh, wonderful. We can see your presentation, and I believe we can hear you, Dr. Gahlot. One more time, if you could, just test your microphone.
Yes. Are you listening me?
Yes, sir. We hear you loud and clear. Very quickly, folks, I'd like to give a quick introduction of Dr. Gahlot. Dr. Gahlot is one of the world's premier veterinary surgeons, and of course, being that he is in the Indian state of Rajasthan, he has much occasion to work with and on camels. The camel is the official animal of the Indian state of Rajasthan, and his surgery center is a pioneering location for surgical practices with camels. Dr. Gahlot literally fell for camels when he was a young boy at his own father's medical practice. He was on the second floor, and one of his father's patients had arrived by camel cart, and the young Dr. Gahlot was So captivated by the camel, he fell off the second floor and landed on the ground in front of the camel cart. And this is the story his mother likes to tell about him falling for camels. So we are so blessed and honored to have you with us this morning. Dr. Gahlot, I turn the program over to you.
Thank you, Mr. Dr. Baum. Thank you for giving me this opportunity to be over there. In fact, due to Corona, we couldn't meet physically. Otherwise, it was a high time to visit US for me, which I planned. Anyway, I welcome all the participants and very good evening from India, because it is evening in India, and good morning over there. And my other introduction is that I'm editor of a journal, which I am operating as editor since last 27 years. So camel is a unique desert animal, and you can see this art, which is golden paint over camel skin by the Muslim community. Usta art, very, very famous art on camel hide. And camels were used since ages for riding and transportation, as you know that they were used in war as well. And in our state, in Rajasthan, that's a desert state, it's a state animal. This is still being used in the ploughing, farming. It is used by border security force to patrol the border. And our clinic, Camel Clinic, is the biggest in the Asia, South Asia. And one day Discovery Channel people came and they shot and camel surgery and all the facilities. We organized a camel conference over there in 2007. Delegates were taken on the camel cart. You can see Dr. Urli and others, you know, over there. And there is International Camel Festival. Every year it is being organized in Bikaner. So it's a hub of camel. Bikaner is a hub of camel. See Camel Bank, see the decorated camels over there, their camel dances. People practice them over the year. See the practicing or creating art on the wool by just cutting them in a design pattern. And this lady comes from Japan every year, and she creates a lot of design. And this is camel fur cutting and camel cutings and camel dances. And you can see all these people are amused to see this festival. You can see people doing acrobatics. So camels are trained, but camel races are there in Dubai. They are more used for races, but for tourism elsewhere, camel is being used in many countries, in Australia even. And people, they really enjoy traveling on the camel. In cold countries, the Bactrian camel is being used. You can see the wrestling of camel in Pakistan, in Turkey. It's Afghanistan, very popular, double humped camel. In fashion shows these days in Oman, Saudi, camels are being used. Races in the entire Arab world, camel is being used, as you all know. Bactrian camels are used for racing. In snow, you can see. So a lot of sports are being done in local fairs in the camel. But on the scientific side, in UAE, the first cloned camel was produced. You can see Dr. Vani, you know, he had the second cloned camel calf in UAE. You can see a swimming pool for camel, racing camel in Qatar. Now, camel hairs and products are big value addition. And right from the village to the city, it comes to the factories, and you can see the finished products, the wool and the garments and the leather products. You can see the milk is really very good for human health. What Dr. Raziq told, that it's a big dairy, he is really expert on the camel milk, and he was showing you very good things. So camel milk throughout the world, it is popular. And you can see mechanized dairy of camel in UAE, and you can see machine milking and see how scientific it is. Now, camel milk products are available in supermarket. Even on duty-free shops, you will find chocolates, Al-Nasma chocolates, very popular. Soap of camel milk, even in USA, this is being marketed. You can see the camel meat is also very popular. That is also available in various packaging. You can see various type of things. So coming back to our university, this is a seat of innovation and practice of camel surgery for the first time and recognized internationally. So very much greeting from the Rajasthan University of Veterinary and Animal Sciences, Bikaner. This is our team. You know, we work day and night, and 24-hour camel clinic is open. And this is open for other species as well. And camel surgery is being done by our surgeons every day, because we have a lot of camels over there around Bikaner. And it's difficult to carry camel in small vehicle. Hence, you need everything big in camel hospital. So half of the topic is based on camel hospital facilities. So I say that everything is big for the camel hospital. Say hydraulic ambulance, a big hydraulic ambulance is necessary. Big outdoor wards, shelters for the camel is necessary. Big area to keep 8 to 10 camel as indoor patients, it is necessary. Now, camel owner carts, you need a lot of parking area also. People are coming from the villages and they can bring their cart also. And after treatment, they go back. Now you see, operation theater is also so big, well ventilated, well padded. So this is also, you need a big area in operation theater. This is a sedated big camel in operation theater. You can see adult camel. This is a camel Travis innovated, designed by me, so that you can do everything in a standing camel and you save a lot of time. Otherwise, you lose time in restraining the camel. You need sometimes cranes to lift a lame camel, fractured camel. You need big manual stackers to lift amputee camels. So these all are part of hospital facilities. Then you need big vehicle to transport sick camels. This is Border Security Force truck. They brought the sick camel over there. Now, coming back to the other facilities, you should have a portable endoscope for to see esophageal obstruction. Now, you have to pass the probing to relieve the obstruction of the esophagus in camel. Now, you can see back in UAE, Dr. Alex Stinson sent me this photograph, and the camel is under general anesthesia, and they are administering inhalation anesthesia. See, such a nice facility over there. We need X-ray. We need for radiography of limbs, neck, and other parts. So this is really needed for the camel. And this is computed radiography section where the analog to digital radiography pictures are there. Now, CT scan facilities are also there. And we are using this CT scan facility in the cadaver of camel parts, you know, like to study the head and to study the limbs. So in cadaver we are using various type of travises depending on the necessity. Now see in the UAE, they are using such kind of travises. Now you need to have very good diagnostic laboratory to diagnose, to have pre-operative hematological and biochemical examination. So in our university, we have even blood bank we have for camels. So blood transfusion is being done. Now you collect the blood from one camel, and first time you can administer this without matching even. And you can, just to show the student, you should have a screen attached to the microscope so the student can see what you are seeing inside. So camel surgery, in fact, friends, it's a big challenge, you know, because there was no book on the camel surgery, and we attempted camel surgery by studying its anatomy, which is really different than other animals. Now, how it is different? It is always an innovation and challenge. And this is an amalgamation of innovation and challenges. Now, you see, what camel doesn't have, it has special anatomical differences. No gallbladder, no mesom, no medial patellar ligament, no navicular bone. Navicular disease is very famous in, very important in horses, but not here. If you see other unique features, we see camel has a hump. Camel has a soft palate diverticulum. It has a chest pad to sit. It has a distal cushion in the foot. It has 3 compartments of stomach. We call this a pseudoruminant. And it has specially placed nostrils and eyes. So common surgical condition of camels usually we see in the clinic are mandibular fracture, soft palate injuries, lacerated nostrils, torticollis, esophageal obstruction, upward fixation of patella, saddle gall, fracture of maxilla, tail gangrene, punctured foot, fracture, etc. Now, if you see the pattern of applying the head halter in Arabia, even in USA, I think you are not using nose packs. And in up picture, you can see no nose packs, but in India, they are using nose packs. And this is really a very serious condition, and there is an injury. I'm sorry, this mobile was creating disturbance. So you can see injuries on the nostril, and there was a gangrene, maggot wound over here. Now during rut season, there is a lot of problem. Camels are so much aggressive, they fight with each other and they break the mandible. And you can see the mandible, and with broken mandible, since camel browses by the lips, both the lips, they go away, camel cannot eat anything. It's such a strong animal, it is helpless. You can see the weakest point is here, the first premolar or tushes. Here, it is weakest part due to presence of alveoli over here. So it is broken and lower jaw hangs. So in our institution, we invented one interdental wiring technique, which is so simple. And after application, the fractured jaw becomes straight. And you can see here how we pass the wire from between first two cheek tooth and then between the central incisors. And wire is ensheathed by polythene tubes. And you can see here, it is knotted rostrally on each side. And you can see such a good alignment is there, and healing occurs. And camel can eat very well. And you can see that it has healed and we have removed the wire. But there are other techniques also, because there are some multiple fractures, oblique fractures. So we are using the brass rod over here, and with the wires it is tied. And these are the instruments, tools which we use. It's available everywhere. Very easy to get, and you can apply. You see very good alignment is there. Submandibular abscess occurs because there is oral wounds and due to fracture of mandible, and you have to open the abscess, and then healing occurs. And this is the site of abscess, and here healing occurs once you open it. Then you can use some more variants like transfixation and putting of the pins, and these one fiber cast is anchored over here. So this is also one of the very good method of transfixation and putting the fiber cast, and camel can eat very well. It is picking the grass. Now you can see picking grass so well. And there is a very good alignment after the technique is done. And then acrylic splint immobilization we are doing. Then we are doing again the fiber cast scaffold technique. This is fiber cast scaffold technique we are using. Camel is grazing so well with this. There are no pins in this, only external kind of thing. Now the upper jaw is also fractured. Here you can see the upper jaw is fractured at various places in the X-ray, and then we just put 4 pins, and then we attach all these pins with the fiber cast, and it is immobilized. So for limb fractures also we are using external fixators, and in very young animals we are getting very good result, but not in the adults. So you can use this thing. Now, during breeding season, camel invites a lot of troubles. Now, this is a soft pellet diverticulum, which camel balloons out with the air, expiratory air, to attract the female. And this is injured, and due to injury, it dangles down, and you can see the gangrene. Over here, this white portion is gangrene. And then it is hanging down, it's a hematoma, accumulation of the blood. This camel cannot eat, cannot drink water. And you have to remove this surgically. So with the long scissors under sedation, then this is being cut by the intraoral surgery. So with sedated camel, you can open mouth very easily. And once you pull it out, camel doesn't close the mouth, and you can resect it easily. So this is resected one. You can see another resected part. Then some of the oral tumors you can resect out very easily. Buccal diverticulum occasionally we get. You can remove very easily under sedation and local anesthesia. As you know that camels, they live in the natural habitat, and this is acacia tree. And the thorns, they injure the eyes, and a lot of injuries of the eyes are there. And you can see conjunctivitis, keratitis, keratoconjunctivitis, and panophthalmia. Then maggot wound in some camels are in remote areas. They don't get veterinary facilities. By the time they come, a lot of problems are there. There's pus in the eye, panophthalmia we say. Then we do enucleation. You have to remove the eyeball surgically. So this is being done. Then ruptured eyeball. Now you can see the cornea is ruptured because of external trauma. This is being sutured over here. And then salivary fistula. Sometimes, you know, you can see the angos salivary duct. So when camel is regurgitating, masticating, a lot of saliva comes, and here is the gland. it comes. But here, the duct is having an opening and saliva leaks down. You can see the wet hairs over here, and bicarbonates are lost. Camel loses the general body condition. So you have to ligate the salivary duct. So this is exteriorized and this is being ligated. And we put lugol's iodine towards the gland to destroy the gland. So you can see the ligatures, and this is finished surgery. Sometimes there is chronic otitis in the camel, and we do some operation, we say JEPS operation like we do in dogs, and the vertical ear canal is resected and opening is there directly in the horizontal ear canal. Sometimes due to snake bite, camel is unable to breathe and you have to carry out the emergency tracheotomy, and you can see here emergency tracheotomy so that camel can breathe. Later on you can remove it. Now, esophagus has some obstruction. This is one piece of cloth we are removing from the esophagus, and this is being sutured. Now, camel has a condition, we call this as a pica. Pica is a condition where there is a deficiency of phosphorus and minerals, and camel will eat unusual objects which we need to remove from the stomach. Here you can see a harrow from the stomach is being removed along with some glass pieces and stone, etc. So all is eaten by the camels. This is done in a standing, sitting position. Now, saddle gall. Since in India, we are using saddle, and this saddle causes some pressure over the region, thoracic region, dorsal thoracic region, and there is a pressure necrosis, and then infection in the deeper tissue, soft tissue. We call this a saddle gall condition. Now, musculoskeletal disorders are very common, and we study the various joints of the camel by CT scan study, MRI studies, and just reached one conclusion that what is to be done on such cases. So you have to diagnose the lameness, which limb is involved, which part is involved. So you have to make a circle, allow camel to move in clockwise and anti-clockwise position and see which limb is showing more pain. And you can use even this hoof tester. Sometimes there is a punctured foot, acacia thorn is there, some nail is there, and you cannot locate. But as you press, camel will flinch if there is really punctured foot. And camel, when it sits, there should be a good symmetrical sitting. But if it is asymmetrical sitting, means there is a pain. Now see, left forelimb is not bearing weight, means this is lame, and you have to examine joint of this. So you have to diagnose the lameness in camel methodically, and you have to see the symmetry of the hind quarter. So you have to look it from the behind, you have to look it from side, you have to look it from the front. So this is really as scientific as in horses, and then you carry out the treatment. Now, this is upward fixation of patella. The stifle joint is locked, and it cannot flex the limb, it will just drag the limb. And since medial patellar ligament is absent, usually we inject irritants at the site of medial patellar ligament where there are some fibers and there is severe inflammation, and ligament fibers are shortened, and the lameness disappears after 2 weeks. Now, camels, they receive a lot of wounds, sometimes sitting on the hot coals, and such wounds are there, and you have to provide a very good protection bandage to heal the wounds. Now you can see the lacerated wound of the foot, and stainless steel wires are being used to suture these keratinized tissue. Now, massive newborn formation. This is osteogenic sarcoma, a sunburst appearance on X-ray. You have to see when there is excessive growth and lameness. Then you can see here squamous cell carcinoma of the foot, and you have to see the swelling of the foot it could be due to osteomyelitis, it could be due to fracture, that you have to diagnose by X-ray. Supernumerary digit, you can see chip fracture of the hock joint, it causes pain. On X-ray, we identify, you remove the chip surgically and close it. You have to do the plaster in cases of fractures, and then you have to remove certain growths which are long-standing. The chest pad is injured many times. You have to provide protection to the wound of the chest pad. You can see over here the chest pad wound. So a gunny bag is applied over here so that the dust and the ground particle, they do not contaminate the wound. Sometimes chest pad is enlarged, so you have to cut it. You have to resect it by the saw, and then the bleeding is stopped by the firing. It's all done under the sedation. And now you can see here, one acacia thorn over here, and there is an abscess here, and this is being removed, a cone-shaped opening is made, and then povidone iodine dressing is done. You can see the abscess, accumulation of pus is being drained through the punctured foot, long standing cases. Now in India, when we use camels for the draft purpose, they tie the tail, and due to excessive pressure on the tip of the tail, you can see here gangrene of the tail, and it has to be removed. You can see epidural anesthesia is being given here at the sacrococcygeal space, and then 2 flaps are created and gangrenous tail is being removed. Camel does sand masturbation. It's very active sexually during breeding season, and then there's a prolapse, preputial prolapse, and this prolapse portion you have to remove surgically, like here, and this is, you can see prolapse portion, and surgically we are removing this, and then finally we are suturing this so that camel can breed again. Now camel has a lot of problem of urinary tract due to ascending urinary infection following sand masturbation. There is obstruction of the flow of the urine, and then you have to, there is necrosis of the penis, you have to remove the penis, then you have to make a new opening just above the scrotums. We call this as post-scrotal urethrostomy. And you see here camel is urinating through this stump. This is a new opening now. This is Salvage procedure. Now castration is being done very similar to those done in the horses and in the ox. You can see the 3 ligation technique is there of the spermatic cord, and it is sutured. Now the infection of penis and prepuce is really another story. As I told you that due to sand masturbation, a lot of infection is trapped in the prepuce, and it causes a lot of complication, and pus is being removed. You can see the big swelling. Camel is unable to urinate, and we are just incising and removing the dead and necrosed tissue. This is a big abscess over there. Devitalized tissue is being removed. Now, in many times, you can see the rupture of urethra and the subcutaneous infiltration of the urine. And you can see the urine coming as posteriorly in the thighs and the scrotums and the ventral abdomen area, and then a new opening is created here. We say that urethrostomy technique is being done. And sometimes if bladder is ruptured, then you have to repair the bladder by doing laparotomy operation. Now you can see the stump over here, post-scrotal urethrostomy, new opening for the urine. So camel is ready to go back after treatment, and the farmers coming from the far flung areas, and they are really thankful to us, and they are doing namaste to doctors that yes, you treated our camels and this is our livelihood, and now they want to go back. So friends, what do we see as a future of camel surgery? Now see in Dubai, the first camel hospital, it's a very big hospital, $10 million they have spent on this, and very nice indoor wards, where there are very good ultrasound facilities, 3D, 4D images they are creating, and it's really a state-of-art technology over there. Like in horses, they are using these slings and hoist system. They are bringing camels in the operation theater and intubating, putting all inhalation anesthesia, very nice facilities over there. Now, sky is the limit for the progress, you know, as we say that hyperbaric oxygen therapy these days, if a camel is very poor in health, you can put them in the compressed oxygen therapy. Veterinary hyperbaric oxygen therapy is being used, and you get 10 times more oxygen, and recovery is very fast. So these chambers are, this is a new innovation. Laser surgery these days very popular, and it causes no bleeding, and very quickly you can do the surgery. Harmonic scalpel with ultrasonic vibration, you give the cut, so minimum time and minimum bleeding, you do the surgery. So that is another innovation. Then endoscopic surgery, it's minimum invasive surgery now being introduced in the institutional levels, in advanced hospitals, autoendoscopy to examine the ears, and rhinoscopy to examine the nostrils. Now CyberKnife, this is really another good achievement, and we call this as a robotic radiosurgery system, the non-invasive alternative to surgery, and you can remove both cancerous and non-cancerous tumors from anywhere in the body. Then interventional surgery is a surgery which is done under fluoroscopy, endoscopy, etc., to pass the catheter, to guide the wires, to remove the biopsy material, put the stents. So you can use this at advanced center. So robotic surgery is a science for today and tomorrow, and we can use robotic surgery on camels and just wait for the opportune time, which is ahead. And operating room, there are no people. So a time is there when camels will also have such kind of surgery, and this is more accurate in dealing with the surgical parameters. So friends, camel surgery is still a challenge, and it needs a lot of innovations. Surgeons would continue advancing camel surgery. Thank you very much for a patient listening. Thank you.
Dr. Gahlot, thank you so much for your time. I know that we had a question from one of our colleagues, I believe in Egypt, Dr. Ala Hamed. Dr. Ala, if you're still with us, I'm asking that you unmute your microphone, and now would be the time that you could ask your question, please. Are you still with us this morning, Dr. Ala?
I think he has to unmute because this is mute.
Yes,
he
sir.
Has to unmute.
Yes, sir. All right. I've also asked that Dr. Ala could ask his question in the chat box if he has that option to do so. So we may move along. Are there any other folks who might have any questions for Dr. Gahlot? It looks like we have a little over 24 participants on this morning with folks from around the world. I know they've been sitting listening patiently. Dr. Gahlot, I would like to mention here that when I visited your veterinary college, you said something to me that I'd like you to expand on, if you don't mind. And that was that so many of the cases that come into your clinic are from local farmers, and that they have simple lives, and the solutions that you offer need to be simple. It needs to be something that they can sustain and maintain on their own. Could you talk a little bit about the typical client, patient that comes into your clinic?
Yeah, of course, you know, the people are coming, and they are in fact so poor. They have few livestock with them, and they don't have enough money, and they earn the camels. They use camel for the draft purpose, and they are having a cart. And when they come, they expect that we just address to their problem of the camel, and everything should be done without any involvement of the cost. So our university, since this is a place where the camel surgery innovation was done, we wanted more and more camels should come over here. So what we do, we simply, all of us, I advise them to put first hand on the shoulder of the client and ask a detailed history, infuse confidence in him that yes, you are at the right place and we are treating your camel, and within few days it will be all right. And just explain him certain risk of the surgery if involved, if otherwise not, then, and owner becomes so much thankful, you know. Otherwise he thinks that I do not know anyone and how it will be done, and so he loses the confidence. So he gains confidence, and then we proceed for the surgery, and whatever we do, we provide from the hospital. And I raised a lot of charity from the local people. Say the Princess of Bikaner, she has offered us an instrument of more than 15 million rupees, you know, so far. And so we have equipped our clinic. Medicines also we are receiving from the charity. University is also spending a lot of money. So farmers are getting free treatment. That's the one reason that people are bringing camels from all the districts of Rajasthan. Rajasthan is a very big state, and people are bringing because they feel that everything is free. Even we are providing dormitory for stay of farmers. They are staying free over there. So that's one reason that we are very much friendly to the farmer, to the camel, and we just see that camel should restore the productiveness for which it is being used.
Wonderful, wonderful response. Doctor, we do have a couple of questions for you in the chat feature. One is from Laura in the US state of Virginia, and she asked if you could please pull back up the slide from your presentation about the special anatomical differences. Can you easily get that and bring that back up for us, please?
Yeah, sure.
Wonderful.
Yeah, that's good. That's good.
Laura, thank you for asking about that, and I'm glad we can work through technology to get that back up for you. You could probably take a screenshot of it. And I should mention to everybody that we are recording all 3 sessions today, and if technology works in our favor, we should be able to share that on social media and YouTube. There we go. Laura, are you able to see that okay?
Yeah, are you able to see?
Very good. All right. Laura, you've gotten what you needed. Fantastic.
You see, I would like to mention here that I write here no gallbladder. So one of my professor who was a good friend of mine, he got his gallbladder operated, it was removed. So one day he met me and he told me that I have become Camel now, because Camel doesn't have a gallbladder and my gallbladder is also removed. So I have become Camel now. So this no gallbladder, so really a peculiarity of the Camel. Yeah.
Thank you so much. Dr. Gahlot, one more question from the chat feature. We've got a participant from the US state of California. Jen is referencing the image that you shared of a camel with an amputated front leg. What was the long-term prognosis for a camel with an amputated leg?
Yeah. That was, in fact, you know, one camel calf, it had one accident with an automobile, and the limb distal to the knee or carpus was gangrenous, so we had to make amputation. And it was a very young calf, and then Honor abandoned this, and we adopted this in our hospital. And we used to feed and water this animal, and it was a female, and it grew later on, and she foaled. I mean, there was a calf out of her. And later on, one farmer adopted this she camel. So this happens that many times people, when they feel that this camel is of no use, they suddenly disappear and abandon the animal over there. Then usually adopts such animal, and we feed the animal, and then just look for the appropriate owner who can look after the camel, and we give it free to the owner.
Well, I know that your services there at the clinic are much appreciated in the Bikaner area and beyond. You said that you have served the border security forces, and I have seen with my own eyes the good work that you do there at the clinic and the wonderful relations you have with your patients, animals, and clients, human as well. Dr. Gahlot, we thank you so much. We are truly honored to have you with us today, and we thank you for your time and for taking on the challenge of working across multiple time zones across the world. Thank you so much, sir.
And I'm not recognizing you without hat. Where is hat?
I have a cowboy hat. I have a straw hat ready for you. It's a little bigger than my head because I know that yours is a little sizier than mine.
Thank you.
Thank you, Dr. Gahlot. Thank you.
We have one more question from Laura.
Oh, I'm sorry, Laura. Go ahead and ask your question. I'm sorry, is it in the chat feature? Oh, okay. Dr. Gahlot, let's make sure that your microphone is unmuted, please. And Laura asks, how do you feed the camels after wiring the jaw fracture? How do they continue to eat?
You need to unmute, Dr. Gahlot.
Hello. Yeah, can you listen me?
Yes.
Yeah. What I was telling you that the wire which we are using here, you can see this wire. This goes just parallel to the teeth, and tongue is free. Tongue is free. They do not interfere tongue. So we put a wire, one on each side, one this side and second on other side. And I show you one specimen. Yeah. Yes. Yeah, it is here. Now you can see this wire, it goes just parallel to the teeth, and other side wire goes here parallel, and tongue is free. Tongue is free. So it doesn't interfere in mastication, and camel is picking up by the lips. So both the lips, they are very close after. Now you see here, lips, they have gone apart. But once you do operation, the lips, they come together. Now here, you can see it's a parallel, just straight. And when you allow camel to graze, the lips will come together and camel can pick the food very easily without any problem. Now you can see here, this camel is picking up. You can see in this picture, picking up food very nicely. So Rafiz is picking up so easily. So wire is there for 8 weeks, sometime 9 weeks, 10 weeks. And we ensure radiographically that callus is formed. Then we remove the device and wire, and then camel is all right here.
Thank you so much.
Hope you got the answer.
Laura, did that satisfy your question? Very good. I have seen this good work at your clinic, Doctor. Again, thank you so much for your time this morning, sir.
Thank you. Thank you so much. Yeah.
All right, Doctor, I'll ask that you stop your screen sharing and we'll move on. Our time is good. We've got about 23 minutes left in this first session. So I will share a presentation that I have made. We have recently had our 12th annual Camel Conference. This year, though, as a reaction to COVID, we moved from the traditional conference setting on a farm in Dallas, Texas, and we decided to do what ultimately would be a 3-day camel trek from parts of far west Texas along the Mexican border. This was on private land, and I believe everybody can see our screen here. And this was a challenging year for a lot of people in a lot of ways, you might imagine. And to be able to hold the event where people could bring their camels, or camel owners or enthusiasts could join without bringing their camels, but to do it safely. And I think that we were able to achieve this. We had multiple participants across, representing multiple US states. Somebody had traveled, in fact, a pair of folks had traveled with a camel 2/3 across the US. Basically, if you look at the North American continent and you look at the Sahara Desert of North Africa, they are each about 3,000 miles across. So the other trainers and I, Colt Lance, C.D. Amar, and Terry Lindley and I didn't take for granted the efforts and distances that folks traveled to be there. The other trainers and I have been putting on this training clinic and academic conference for over a decade, and we appreciate that folks would have trust in us that we could put on this event safely during a pandemic. And after some consultation with folks in the public health sector, we determined that private land measuring about 119 square kilometers was probably likely to facilitate social distancing. So our group gathered, and folks had brought in their camels in trucks and trailers, again, from 8 US states. We gathered, and this would ultimately be a 3-day camel trek, 5 total days together, 4 nights camping. Some of the folks brought trailers that had living quarters in them. You might imagine a rolling caravan for our European participants this morning. A lot of folks slept in their trailers with comfortable living quarters. Others slept out in a tent outside. And then the next day we began our movement of camels, training the camels and putting them on the trail, really putting into practical application what a number of these camels have learned in years past in our traditional clinic setting. We had 14 camels on the trail, and these camels represented varying skill levels, various ages. Our youngest camel was right at 1 year. I think we had some camels up into their early teens, and our participants were probably as varied as our camels. We had families. A family had shown up with 2 youngsters, a 3-year-old and a 5-year-old children, and they really brought a wonderful feeling to our event. This was a great family event, and those 2 youngsters, the 2 children, really brought a wonderful feeling to our camp. They rode their parents' camels each day, and we were averaging somewhere between 5 and 10 miles a day as we would go out from a camp and back. You can see in that image on the left, in the distance, that's our camp. We had moved from one of the earlier images where you had seen the trucks and trailers. We had moved all the gear to this location. In some cases, the camels carried their owner's gear. If the camels were a bit young or green or novice in those skills, then we took some of that equipment ahead by vehicle, and we set up that camp. Again, you can see that in the image on the left, and it was from that base camp that we began our daily rides. After breakfast, the group would move, and we would return to that location for lunch. On the first day, that's how we ran things. On the second day, we left from that camp and followed essentially that same trail and went a little farther and ended up finding a beautiful spring that we could have lunch around, and everybody enjoyed the cool water. Desert temperatures this time of year in that part of Texas along the US-Mexico border were still well into the mid-80s Fahrenheit. So certainly warm, and the water that we found at the spring, you can see in the lower right image there, was definitely welcome. Many folks took advantage of the cool water and did some swimming. We had our lunch, and then we returned back to that base camp. Again, coming and going from there, everybody had set up their tents. On the long day when we went to the spring with the group, one of our camel clients packed all the lunch on her camel, and we had instructed her that while all the camels are special and appreciated, her camel carrying lunch was the most important camel that day. And of course, the meal, the food, all the groceries made it to our lunch stop safely, and everyone was able to eat. This was a fantastic event that brought together, again, people from across the US, and most were folks who had been with the Camel Clinic before. They had been participants prior, and their camels learned quite a few skills over the years in preparation for something like this. It's not every camel in the US that spends time out in the desert. Many are privately owned by people, and they amount to essentially a pet, someone they can spend time with, like a family dog or a cat. So for certain, you can assume that for a number of these camels, this was quite challenging to actually go out and do multiple hours on the trail, multiple miles in a day, carrying both gear and or a rider. So the challenge was accepted by all of the members, all of our participants. And I think everyone would agree that from the first day until the last, each camel really progressed in their skills. For our international participants joining us on this Zoom meeting this morning, you should understand that life for a camel in the United States can be very different than life for a camel in Egypt or Pakistan or India or the United Arab Emirates. I referenced just a moment ago that camels in America are treated a bit like pets, like a family pet. So the challenge for some of these camels, not all, but for some of them, was truly great. And it was nice to check in with each camel owner throughout the weekend to see how they felt their camel was developing through the event, and also to find out how the owners felt that they too were progressing through the event. I'd like to stop sharing this screen. We can do that, please. And forgive me, I'm a lot better working camels than I am computers. There we go. So a huge thanks to all of the participants for this year's clinic who had come from multiple US states. Big thanks as well to our trainers. Our trainers, as in years past, were Terry Lindley, who is a mobile animal trainer here in the US. She is from Oklahoma and travels across the US training all manner of species of animals, camels primarily, but her experience over decades of training certainly helped us to move those camels safely throughout the 3 days. One of the other trainers, Colt Lance, is a third-generation camel trainer. His grandfather, Dave Hale, helped to create what is our small but close-knit camel community here in America. I was a trainer, and our fourth and final trainer was Sidi Amar Tawa. And Sidi is ethnic Tuareg, nomad from the Sahara Desert, born in the modern country of Niger. He is now a US citizen, and I cannot overemphasize just how important Sidi's skills were on the trail. Bringing a diverse group of clients and humans together and then expecting them to all move in caravan daily as we did could not have happened as smoothly if we had not had Sidi out there. Sidi truly was born on a camel caravan as a Tuareg nomad. This was his life. And if we had any slight hiccups or speed bumps on the trail with a given camel, Sidi instinctively knew from his own life as a Tuareg nomad just how to get in there and get things moving quickly. So again, we cannot overemphasize just how important Sidi was as the overseer of our caravan. And I know that all our participants recognized his quick thinking and his ability to keep things moving. Not only do you have the inherent challenges in a trek like that, the inherent challenges of people and camels, especially bringing together a diverse group that had never moved like that together. But again, to kind of restate what we had started this session with, this has been a challenging year, without a doubt, because of the COVID-19 pandemic. So thanks to all of our participants for being willing to put on such miles and to put out such effort to come and be a part of the event, and for trusting that we could in fact put the event on safely. So big thanks to everyone. We are nearing the end of our first session. Do we have anybody with any questions about...
Jen has a question for you, Doug.
Thank
She
you.
said, post-COVID, might you try this type of clinic again, or would you return to the traditional clinic?
Okay, we have certainly thought about this. Oh, I see the question in chat there. The other trainers and I have discussed this around a campfire out in the desert of West Texas, and we posed it to the attendees who were there with their camels. And I think the consensus was that a camel trek clinic like this, like we held this year, is only possible because of the work that has been done prior in our traditional clinic setting. So it's a bit like a sequential or a development of skills. We did have a number of folks say that because they are farther along in their skills and their camels training, that they didn't feel that the traditional clinic was something that they needed to be at, that some of the training skills there are a bit rudimentary for them, but they recognized that other participants might need to build up or develop skills in their camels in order to take on a challenge like a trek. So moving forward, as though we don't have an exact plan for the future, I think everyone's in agreement that we will be doing both, one probably as prep for the other. So definitely stay tuned to the clinic Facebook group for information on how things will develop for 2021. This is all, of course, assuming that we get the pandemic behind us. Otherwise, it looks like we might be doing things again like we did this year. So thanks for everyone's patience with how things can develop. None of us seems to be in control of any of this these days. So we are reacting to the information and the best practices that we can get from health professionals. We do have a chat question from Heather Beck. Jen, I hope that answered your question. Heather Beck asks, what was the most challenging part of this year's clinic? I think probably, you know, like any journey, right? There's a great Chinese proverb that says that every great journey begins with one small step. And I think all of the participants will agree that that first step on day one might have been the most challenging. We had a couple of very green or novice camels that while they may have worked at home for their owners fine, in their backyard or their pasture or their field, this was new territory for them. And so that challenge of just getting moving and just moving the caravan as one solid unit was, we'll call it organized chaos for the first 3 to 5 minutes. But again, to kind of dovetail back around to CDMR, our caravan leader and our overseer, he jumped in to make some decisions about positions of camels and relationships of camels, in that we had a bull camel, an intact male, we had castrated males, and we had females. And those dynamics, when you bring a group of camels together who don't normally live together, could make for a little bit of a rough start. And I think everyone would agree that might have been the most challenging part. But honestly, within 3 to 5 minutes with CD's acumen and acute observation. He positioned everything in such a way that we were able to move safely and expeditiously. Heather, thank you for that question. I hope that answered. Laura comments that recording this will be an amazing asset. Yeah, definitely. We are recording this, and we'll, Laura, try to get this on social media, YouTube. We'll have this out there for the world. Heather, well, thank you for the kind words. Any other questions? If we don't have any in chat, and I don't see any raised hands, then we'll just move on with a little bit of business. I want to look
there is one more question, Doug.
Okay.
Venkat has a question for Dr. Gahlot.
Oh, I saw that earlier, and if Venkat is still with us, I know Dr. Gahlot is with us. Let me find, there it is. Actually, that was during Dr. Raziq's presentation, and I'm not sure that Raziq is still with us.
No, he chatted me privately.
Okay, yep, and I see Venkat's question. So I would maybe ask Dr. Gahlot if you could go to the chat.
I am here.
Very
I am
good.
here.
Oh,
I am
Dr. Raziq,
yes.
Dr. Raziq, thank you. Listen,
I am here.
participant Venkat asks, in terms of camel breeding, is there any breeding program whereby the original breed is maintained? He says that he has seen cows being converted into hybrid breeds where the original gene is manipulated. If you understand that question, Dr. Raziq, could you please address that?
Yes.
Venkat?
Yeah. Yes, thank you. You know, here the breeds are owned by some tribes. They have the guardian tribes. So here the main breed is, the most important breed is Arabic Camel, Arabic Camel, which is for race. So it is well maintained, and they even know, they have memorized the name of mama and grandmama and grandmama of the camels. So they have the whole story of each line. So that is well maintained. The other camel which we use for milk, that is usually we use two breeds. One from Pakistan, Barela, which is like in the adjoining areas of Sindh, Punjab, and Rajasthan, from where Dr. Gahlot is. So that is like mainly in Pakistan. That breed is also very good for milk, and we bring this camel from Pakistan, and the other breed we bring from Saudi Arabia. And these both breeds, they have very strong tribes behind them in their origin, and they keep the breed in a very good way. And because nowadays they have very good, there is very high demand for such camels, so they are well maintained. The local, the regional, the local here, the local breed is Arabic camel, which is well maintained. There is no danger for their breed, for there is no threat for the breed and for the dilution or something. And we entirely use the two breeds for the camel milk.
Mumtaz, thank you so much, Dr. Raziq. Hopefully Venkat is still with us and he was able to hear your response. If not, thanks to the technology and being able to record, he will be able to watch this back and get that response. So folks, we're going to wrap up this first session, and hopefully we will be seeing you and others across multiple time zones for session 2, which will be happening at 3 p.m. Central Time here in the US. We have a presenter, Dr. Ahmed Isa El-Hag from Sudan. We have a US presenter, Samantha Arevalo from Green Chimney School, who will be talking about camels in therapeutic settings. And then we will have another US presenter, Gil Rigler from Oasis Camel Dairy, who will be doing another camel milking demonstration for us. Then we will end the day with a third session with a single presenter, Dr. Sarang Hasi from Inner Mongolia province of China. Dr. Sarang and I are, as we wrap things up here, we are going to test his signal. This will be an inaugural Zoom event for Dr. Sarong. So those of you who have joined us this morning, thank you so much. Dr. Sarong and I will stay here for just a moment to test his signal, and we will see everyone back here, inshallah, around 3 p.m. Central Time for our next session. Thank you, everybody.